Let's talk Hillsborough. People having pain in their arches and anyway they can't walk and stuff. Explain a little bit some of the, when do I know that I have Hillsborough or some other pain? And again, most importantly, if there is prevention, please let us know, of course. But definitely, let's talk about treatment for the people who have it already.
Okay. So if you wake up in the morning, get out of bed and put your foot down and you're having pain, if you sit down for a while and get up again having pain, there's a good chance you have a condition really called plantar fasciitis. Well, it's a fancy word, a $25 word for inflammation of a ligament that goes from the heel bone to the ball of the foot. Now, when that ligament constantly pulls on the bone will get aggravated, traumatized, and the body likes to protect itself. So it lays down calcium to protect the bone. And the calcium is the spur. Some people have spurs, some people don't have spurs, but everybody who has those kinds of symptoms, most of them have what's called plantar fasciitis. The spur, the key thing is this, and we tell this to our patients all the time, and everybody's fixated on that little bone spur that looks like a hook of bone that you can hang your coat hanger on. It's not painful at all. Why? Because you're not stepping on it. The spur is not going downward, it's going across, and you have this ligament that's pulling on it. As it keeps on pulling on the bone has a covering with a lot of nerve endings in it. That's what's painful. So, again, you have to stop the pulling of that ligament, and if you stop the pulling, the ligament won't become inflamed anymore. All kinds of people get this. Everybody thinks, well, only people who are overweight get Hillsborough's or plantar fasciitis. We see a lot of the runners and athletes, they get this. Example, the New York Giants quarterback about a year ago, Eli Manning, had this. And a lot of athletes have this kind of problem. So that's why. So anybody can get this. It's mostly, the kids don't get this usually, but it's mostly young adults to all the way to older adults. And so the double-edged sword here is that people say, well, if I lose weight, if you lose weight, the pain will go away. But they can't lose weight because they can't exercise because of the foot pain. So it's a double-edged sword there. There are many things you can do for plantar fasciitis and Hillsborough's. 40 million people in this country are suffering with this problem. And if there's a way to treat this, at Family Foot and Ankle Specialists, we have a way. Usually 95% of the time, a cortisone injection, taping, stretching is used, stretching and icing, and we will give you proper stretching exercises. And a custom orthotic will take care of this problem. Now, not everybody needs a custom orthotic.
Shade a little bit of light on a little bit of some proper exercising things. Like just, explain a couple of them a little bit.
Okay. What we do is when you come in, we have this whole exercise kit. So one's this band, and you can use a towel, but it's a band that you put on the ball of foot, and you will stretch your foot back. That will stretch out this ligament. You hold it for about 10 seconds and do about 10 to 15 repetitions of that. And then we have this roller, this foot roller, that you put in the freezer, get nice and cold, and just roll it over the arch into the heel, which again will stretch out the ligament. But the cold from the roller helps decrease the inflammation. So it saves you time. You could be at your desk working and just roll out the ligament with this foot roller. It's a great little device. And there's another one where you just put the ball of your foot on the edge of a step and just lower the heel. That also will help stretch out this ligament. So they're wonderful exercises. So a lot of these things, if you like, the first time it comes about, you can just take care of this yourself and try to do those exercises. Lots of ice, no heat, ice, please. 15, 20 minutes, a couple of times a day is a really good thing for that.
Okay, good.
Okay, so
go on.
Yeah, so a lot of times when they come here, like I said, 95% of the time, we can get this better quickly with conservative measures. But there's about the 5%ers that need something else. And it's rarely ever that we need to actually operate on this. We do a procedure that I've been doing for about 8 years. I've done more of these procedures than any other doctor in the country, and I can say that because the guy who trained me is now retired, so I can say that now. And it's a procedure called cryotherapy or cryosurgery, where with a very minimal nick in the skin under a local anesthetic, and we can sedate you as well if you need be, we put this little tiny probe in that sends liquid nitrous oxide at a minus 72 degrees Celsius that freezes this ligament and the nerve that shoots around it. Doesn't damage anything. It just freezes it and gets rid of this inflammation. And it works on the outer layer of this nerve. So the nerve now has an amnesia effect, but it doesn't destroy it. So what I'm saying is that if you stepped on something, months down the road after you all healed, you would still feel a new type of pain. You just don't feel this pain. And we have over a 90% success rate with this procedure, because we use it when we have to use it. And then we have other technologies such as radio frequency, shockwave therapy, which is using deep, high energy radio frequency waves that will bring in new blood cells in the area and clean out the area, clean out the old tissues and allow the area to heal faster. And plus, in conjunction, we can also do PRP, which is platelet-rich plasma, which is we draw blood from you and put in and spin it down to get just basically these platelets and inject the platelets right back into the foot, the area of the foot that's painful. Again, bringing in blood, bringing in these cells that help healing and speeds up the healing process.
So basically there seems to be a lots of circulation problem, which with any infection, circulation doesn't go in the area where it is infected, which then just fosters it to grow almost, I guess. So that's one of the things. So first of all, the last thing you explained really only applies to about 5% of cases. All other 95, they get really cured with exercise and a little bit of maybe you said some cortisone injection or something like that, or anyway.
Or orthotic, yes. Yeah.
And orthotic. So most of them get cured rather fast. Does it help curing it faster, or does it make it more complicated it's probably a stupid question, but if a person keeps it up, meaning, he feels pain, he goes, okay, forget it, it goes away again, let's not go, and then years later, would the treatment take more time than if you would have gone right away?
Yeah, when the patient comes in, and it's usually men who come in way about 2-3 years later, it's going to take longer. It's going to take longer to heal. At that time, you build up probably lots of scar tissue in the area, and it's no longer plantar fasciitis, it's plantar fasciosis. Again, all it means is a bunch of scar tissue laid down in that ligament, which now doesn't have any blood flow. It's devoid of blood. So the healing process will take a lot longer. And I practice in New Jersey. We want to get better. We want to be better yesterday. So the best way to do that is, one, recognize you're having something going on in your foot that's not normal. And in this case, if you're watching the video and you have that symptom of the pain, do the stretching exercises and ice it. And otherwise, come visit us. Treatment is so simple today and so virtually painless that the longer you wait, the longer it's going to take to get better. And with the high cost of co-pays and insurances and deductibles, it'll cost you more money on top of that.
Right. So let's take me here. I would probably say 2, 3, I don't know, probably a half a dozen times. I probably forget some in, the last decade. I did wake up and I did have pain in the foot. But as I said, that's like maybe 1 day or 2 days. And then, I'm 58. It happened a half a dozen times. And maybe it happened a dozen times. Maybe I forgot some of them. I'm sure I did. Do I have to worry? Not really. Yes, no,
No, you don't have to worry at all. I mean, you just have to take care of it. And like I said, if you have that issue, if it happens just once or twice, do those stretching exercises and ice it down. If you can, take a couple of Advils. But when it lingers on, after a couple of weeks, day after day, a couple of weeks, it's about time to give us a call. I mean, you can try some of the over-the-counter products. And I say go ahead. If it works, fantastic. Sometimes it does. Sometimes you just need a little cushion, cushion that you get over the counter, that's fine. If that doesn't help you, then you've exhausted all the over-the-counter products. Then it's time to make an appointment.
Well, all right. Thank you very much, Dr. Wishnie.
Thank you.